Are you looking for a podcast where you can hear from real people regarding their real dental drama? If so, then you've come to the right place. Join hosts Bethany Petty and Dr. Rena Kuba as we dive into the solutions we've created and the mistakes we've made while managing dental drama. Let's get started.
Howdy, howdy.
Hey, what's up?
Not much. So I've got kind of I don't think you're going to expect what I'm about to say here.
Okay.
Which I like keeping you on your toes every now and then.
I feel like everything you say shocks me. So
Good. Okay. I like it. You never know what's going to come out of my mouth. Which is funny, preface to what I'm about to say here.
Okay.
So I'm always talking about, how can we impart wisdom to our teams? How can you impart wisdom to me? How can I, add to the repertoire of my associate and the dental student, right? So that's we're always trying to share wisdom and help people come up because somebody helped us come up, right? And so my topic for today, how do we know when to shut up? I had a moment today that it had nothing to do with dentistry, but it was with my dad, who I love dearly, and he is one of the sweetest, cutest, most charming people. People who meet him are just he's just adorable, and he is. But we can butt heads. And I think for him, he's my stupid middle child again is just going crazy and not following traditional Indian, methodologies of yes, father, no father, you're right, father, right? I'm always the one. My older sister follows that to a T. And then I've always been I don't know, man, that doesn't really make sense to me. And he's Urgh. But we have a great relationship, whatever. But today was not a great relationship day, and he and I were at odds about something, and I was well, let me explain why I think this blah 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 blah. And I go off and rattle off what I'm thinking, and stupid me, I know him, and why did I bother? Because I was waiting for this moment of I see. And he did not see at all. And he's well, that's just wrong thinking. And I was it's not he slapped me in the face, but that's almost I kind of whipped back, was whoa! And I was mad at myself for going, why did you think you would change the mind of this 91-year-old man? What were you thinking? You are the idiot here. Why didn't you just shut up? Clearly he was not ever going to see it from your viewpoint. And now I'm frustrated. And now I've frustrated him. I could see the irritation all over his face. And he's usually just such a happy face, right? But you could tell, the grimace on his face. And I'm just and of course it all happened, right as I was about to leave their house. So now I'm okay, now I've, left this stinky fart, floating in the air. Bye. I've trapped him in the car with it. Peace, I'm out, right? And so I just was why did I do that? Why cannot not just learn to shut up? And so I knew I would be meeting with you later. Mm-hmm. And so I'm you know what? I'm sure for all the things we talk about, we should talk about this, and we should talk about our compensation reviews, and we should talk about feedback. And so I'm going to challenge you with the opposite. When do we need to shut the F up?
That's a good one. We don't talk about staying quiet or biting your tongue, or we really don't. But it is exceedingly valuable to think about that. So I have a few things that are already popping up in my mind.
Do you?
Yeah.
Okay.
Yeah.
Well, I thought I was going to stump you here for a minute, but I thought I was going to have you shutting up for a minute without advice.
Maybe we should just end the podcast with silence. The next 30 minutes of just...
Is the next digest going to be blank?
Well, to at least have the title page, when to shut up.
Yes.
All blank.
Yes. There you go. Now
Dr.
is the time
Kuba
to shut up.
says ...
We don't know, because she finally decided to shut up. But no, seriously, there's a time and place to hold it in and why I thought I was going to change this man's mind. And then, like, even as I'm thinking about it, I'm like, yeah, there are multiple times with patients that, you know, you're like sitting there trying to go, but you need to sign on for this because blah, blah, blah. I'm like, maybe there are times that I'm like, I should just shut up and let the patient sit in that uncomfortable silence and wallow in why they think it's a good idea not to fix the abscess tooth. You know what I mean? So I think that's what I wanted to talk about today, is because we're always talking about what to say. And I think I want to highlight the value of maybe not saying anything and just shutting up.
Yep. So I can think of two things right off the top of my head that have actually come up this week that I think are relevant to this. One is a employee that was receiving some very difficult, harsh feedback technically from me, but on behalf of the practice owner. Just performance issues that were reaching a point. She'd been talked to on multiple different occasions, and it was reaching the point of like, shape up or you're out type conversation. And in that conversation, there was a lot, I wouldn't call it rebuttals. I would call it explanations for, questions to clarify, like, that is a moment to me when to shut up. When you're receiving harsh feedback, or even feedback in general, I think close your mouth and open your ears to listen. And that's not to say that you can't say something at some point, but you probably shouldn't for a while. You need to ruminate on it. You need to think on it. You need to, if you're thinking about what you're going to say next, you're missing what is being said to you in that moment. And your explanations, your excuses, your
defense
is not helpful in that moment. It's not helping you at all. But it's certainly not helping the person that's giving you that feedback.
So in defense of the defensive person, because I think I've come a long way with that, I think it is where I'm going, no, I'm being misunderstood, or you're not understanding why I did this or what. And I think what I was lost for me for a long time was, but they do. And they're seeing beyond that. And I'm still caught up in this level. Yeah. And they've elevated past that level. And so I think that, you know, has been something that over time, because I'm like, no, I had a reason for this, and listen to why. And kind of like with my dad, where it was me going, well, this is why, you know, I said this, and you could just see all over his face the aha moment that I was anticipating never came and isn't going to come. And so for me, it's like, okay, then I need to think beyond that. Like, what's the next level beyond that? Because he's not on the same page as me, does not want to be on the same page as me, and won't be.
Yeah.
And so should I have saved my breath and prevented me leaving from that stinky fart in the room feeling?
Yeah.
You're just like, why did I bother?
Yeah. It's not, there's times when it's just not worth it. Which sounds, I mean, with all the episodes that we've done, I think you're exactly right. We've really not talked about this, because we're always, but communicate this way, or say this, or approach it from this standpoint. And there is a value to, from time to time, just quit talking, just listen, or recognize we're not going to come to an agreement on this. I can't tell you how many times I do this, even in my marriage. I've learned over the years, early on in marriage, I'm like, but he's got to understand this. He's got to know that this is why I'm upset, so that going forward, this won't continue to happen. And now, 22 years into marriage, I'm like, I ain't never going to understand. And so I can waste all this breath and energy trying to explain why it bothered me. But if I know he's never going to get it, then what's the point? Like, why sit here and try to explain it again? Just come to terms with the fact he will never get it. Think outside the box. Because if this is going to upset you every time, fix yourself at some point. And so it's like, okay, we're done talking about this. And so I'll catch myself from time to time when I can feel myself getting frustrated explaining something. I'm like, never mind. Sorry, never mind. He's like, well, no, you can continue. I'm like, nope. Because if I continue, I'm going to get upset. You're going to be like, I still don't understand. Let's stop myself before we even get to that point. So there's value in being quiet.
Yes.
For sure.
So what happened with this one then that was getting the feedback that she didn't want, or she kept...
So
whatever?
at one point, because again, this was multiple conversations in. And at one of the points when she was responding, I just said, hey, this really isn't a conversation. I'm sharing this information with you. I'm letting you know that we are already looking for other options to potentially replace you. If you have any kind of shot at keeping your job, it needs to be a miraculous turnaround. So I don't need to hear what you have to say. This is for you to receive the information.
And how did that end? Like, did she receive it, or did she leave, or did she...
She did recently get let go. So all that to say, again, I don't think that was necessarily because she didn't, well, I mean, I think she didn't listen. I made it overtly clear, like, I'm giving you like basically 2 weeks to show a miraculous turnaround. And if that doesn't happen, you will be fired. And so maybe she didn't listen. Maybe she just was like, oh no, I got to start looking elsewhere for another job, and didn't focus on what she could have done to preserve her position. But ultimately, I don't think she listened. So I think that's when it gets us in trouble. Like when somebody's coming at us with information, our natural response is to be defensive or to explain or to justify. And sometimes we just need to shut our mouth and absorb what we're hearing, chew on it for a little bit before responding.
Oh, yucky. That whole thought of how that conversation would have gone down, for you to have to say to somebody, hey, I need you to listen, like to get you to that point. Mm-hmm. Oh, yucky. Okay, so you said you had 2 examples. So that was the one.
So the other example was actually patient interaction that I was able to witness in an office. And again, I give big kudos to the team member that I work with, the business team member, that I do believe did her darndest to try to get this very escalated patient de-escalated. And thankfully, again, kudos to her. After the interaction went very south, it did not go well. She came back immediately and said, all right, tell me, what could I have done differently? And just like we're talking about with this other employee, she listened. Like, she didn't justify, she didn't explain, she absorbed every amount of feedback that I gave her, and that's exceedingly valuable for somebody to open themselves up to feedback like that. So I'm going to use that as an example in when to be quiet or when to not say something, but I have to preface that she did a lot of things well in this conversation. It was a very tough situation. So the gentleman came in exceedingly upset about, what are they always upset about? Money. It's 95% of the time it's about money.
99.5%
I
of the time.
know. So he was upset because he thought this procedure was, $1,200, and it was actually $1,400. And so he was making he came in hot. So he was saying things like, y'all are unethical, I can't believe, a lawyer would eat you up with this, just saying a lot of very inflammatory things. It is very difficult to stay calm when somebody is coming at you like that. And so this lady stayed extremely calm. But what she did wrong, and I told her this, is she spoke too quickly, too soon, too much.
What do you mean?
This would have been a great opportunity when to shut up. Because he came in and was firing out all these things. Well, what we try to do in that scenario is, oh my gosh, there's so many fallacies that he's said here. Let me help correct him, with the facts. He's not talking facts. He's talking I don't know what he's talking about.
So let me set him straight.
Yeah.
He's got the wrong facts. Let me outline, and once he sees that this is the factual outline, he'll be fine.
Yeah, then he'll be like, oh my gosh, I totally see it now. Look, it's right there in writing on the treatment plan that I signed. So it's like, we know we've got the trump card. We literally can win this conversation because the treatment plan clearly says this. And oh, by the way, look at that little signature there. Like, that's your signature. And so, but then that is not the way she presented it, by the way. I'm saying that's not how it was presented. But I think she was like, oh, I can fix this by explaining this situation. But he was not in the place to listen. Not yet. And so what she should have done is, let me keep my mouth shut. Let me listen. Let me ask follow-up questions to make sure I understand what he's saying. Let me make him feel fully heard before I open my mouth at all with an explanation. And I do believe, and there's no way of knowing, but I do believe in this conversation, if that would have happened, if she would have not said anything, waited for him to deflate, to get all of his nasty comments out, ask some clarifying questions. So what I'm hearing you say is this. Am I correct in assuming this? Blah, blah, blah. And then ask permission to say, hey, would it be possible for me to explain this document that I have that goes over the treatment plan? Could I share that with you? And then lead into speaking. I think it would have been a very different conversation. I really do believe the one mistake she made was not staying quiet long enough in that conversation.
So how did it end then?
But not well. Not well at all. He left angry. She was not able to de-escalate. He left making all kinds of threats to the practice. And so, unfortunately, she couldn't de-escalate. And I think really her best effort was put forward, and it just couldn't de-escalate. But I think it's a clear example of, man, sometimes just keeping our mouth shut.
So any tips on kind of knowing when we should do that? I guess in this case, it's like somebody that's clearly on an emotional train versus a logical train.
Yep.
And I know, like, for me, outside of the practice with personal relationships, there are friends and family members and things like that where it's just like, okay, there are moments where I'm not dealing with a logical person right now. And like my family, for example, we're a very emotionally driven family, and my husband's family is very neutral. Yeah. So I've learned a lot from him, where the downside can be you're so neutral that it's like, are you alive? Do you care? Like that. I guess that's what I'm kind of asking is, like, are there moments where if I shut up too much, is it like I'm going to come across as I don't care, or that I'm not listening? So are there times that you would know that shutting up is what we should be doing?
So I'm going to give you a counter example here in just a second from a team meeting that I had today. So anytime we're dealing with an emotionally charged person, the default mode should be quiet for the most part. I mean, there will come a point in time when you feel that person settling down that you can then engage with them. But when you're dealing with an emotionally charged person, honestly, your words aren't going to be very helpful at all, other than clarifying questions or paraphrasing it, So I think that I use the term, like, the teenager principle a lot to describe these situations, because it's like we've got 13-year-old daughters now, and there's moments and times where my kid is a level-headed, just great kid, but there are times where I'm like, oh my gosh, she is like highly emotional. So you think of like what we imagine in our head as like a typical teenager, just off the rail emotion and crying and blah blah blah, and you're like, would we come to them in that moment, to a zit-faced 13-year-old emotional teenager, and be like, honey, the logic of the situation is, you don't need that boy. That boy just shouldn't, you shouldn't be this upset about a boy, right? You're like, is that going to help that person? No. That would not help a highly emotional person in that moment. What do? You go, tell me more, talk to me about it, fill me in. listening. So when we think about that and we kind of apply it in an adult setting, it makes a lot of sense. Like if you've got a 70-year-old man that's throwing a temper tantrum, that's not the time that we come in with logic. It's not going to work. Just like it wouldn't work for the 13-year-old, it's not going to work for this 70-year-old teenager that's throwing a fit right now. So
I think that's the stumping part, because we have so many 40-year-old, 70-year-old, 35-year-old, 55-year-olds that we don't typically expect to be a 13-year-old meltdown moment right now, and we're seeing that all the time.
Over.
And I think social media is the kind of the crux of, because people are allowed to do that online and then they carry it out into the real world.
Yep.
And anyway, I think that's part of why I think some of this kind of ends up slapping me in the face, because I wasn't expecting it, which I should be expecting it.
Yeah.
But to me, I'm like, wait, for real, this like 60-year-old is going off the rail about $200, like in your example, or my dad, who's typically a very calm, understanding, he's the ultimate people pleaser. And so me thinking like a fool today that he was going to see my side, and no, he reverted back to teenager mode.
Yes.
Or was I the teenager trying to press my opinion on him? So I don't know. Anyway, back to your, teenager.
Yeah. Imagine teenager. So we attribute too much logic to adults. Like, oh, they're an adult, they should be able to logically navigate this conversation. But when you sense an emotionally charged person, you need to think, the teenager rule, keep your mouth shut. Just shut up and listen. And so I think that's one example. Now, to your question though, a counter example. Like, if you're ever too silent, does it show apathy or too much neutrality? So I was at a team meeting today with just a precious doc of mine. I just love working with him. And his team was giving him a hard time during team meeting because they said, we were talking about communication, lots of communication tips that we were talking about today. And he was talking about how he really struggles with communication. He's a male, he's got, a wife and daughters. And he said, this is just something I'm always having to work at. I'm not good at it. I tend to want to shy away from real intentional, deep conversation. It makes me uncomfortable. And so his team was all like, no, really? Really? Is that true? And obviously they're like, it's very true. And so, one of his team members was like, hey, I'll say Dr. Jones, oh, hey, Dr. Jones, by the way, I tore a tendon in my ankle and I might have to have surgery. And she was like, what kind of response is, Or, hey, Dr. Jones, my father-in-law's dying. I might have to be out next week. So she was giving him a hard time, saying, no matter what information is shared with you, it's, So there could come a point where keeping your mouth shut can be seen as apathy, and the point she was trying to make is, no matter how dramatic it is, it's the same response. And he shared, and he was like, I just don't know what to say. Like, what do you say to that piece of information? And so he's like, I don't want to say anything, but I don't want to say the wrong thing. And so, is just, it fits. And she was like, but it doesn't. It's not an appropriate response. So to your point, I think there's times where we can't stay silent, or our silence could be seen as apathy or not caring.
I think I've always been, because I come from this super emotional family, that I've always thought of that as uncaring.
Yeah.
And getting offended by it and going, okay, I just told you. I may have mentioned this at a different episode, a different podcast episode, but I go back to Seinfeld, and there's an episode where the boyfriend doesn't put an exclamation point after the news that Elaine's friend was having a baby, and they break up because she's like, well, you didn't show enough enthusiasm about this. And I'm just like, yeah, I see that. Like, I totally see that. You don't care that I tore my Achilles. Like, what kind of human are you, right? And like, give you my blood and soul, but you probably expect me to hobble in on work anyway. You don't even care about my ankle, right? So I think there is something to be said for, expressions and emotions and meeting people where they need to be met. So yes, that is absolutely the perfect example of like, no, we need you to say something. Some reaction.
Which to me is like when to shut up. So if you're a natural shut up person, like if you just naturally avoid communication, your default mode is actually don't say anything, then you may actually have to be challenging yourself. How can I say something? Because you're going to be...
This podcast is not for you.
Yeah.
We should have said that at the beginning. Turn this off.
Don't listen anymore. Go listen to the 200 other episodes we have on communication.
If you are a robot, turn this off. So my husband, I'm like, are you... Hello? Do you have feelings? What is going on here?
Yeah, he can listen to all the other... Every other episode that we've had is
but
on
if
communication.
If you're like, no, I've got this. I can explain why, and you will come over to my side.
This podcast is for you.
Yeah.
Listen closely. Well, I think it's interesting because you may not realize it, but I think you have an example on this. You mentioned that at the beginning of this episode that you were trying to explain and trying to win your dad over to understand your viewpoint, but I think you also have had a lot of growth in the area of when to stop coaching or trying to teach somebody. So why don't you share your example on this?
Yeah, I is it what I'm so like just teaching?
Yes, when you feel like think about the situations you've been in, not only at dental school, that obviously you support with the dental school, you do a ton of just coaching individuals, giving free advice, free support. And then there's times when you're like, okay, I've said all that I can say. I need to probably...
I think, yeah, and I've grown a lot in that because I think it used to like hurt my feelings when I'm like, okay, hey, I've just imparted this on you, and you're like, and then you just move on. And I'm like, did you hear a word I just said? Or do you understand? Maybe, you know what? It was me. I didn't explain properly that I maybe either talked too much about this or didn't give enough information about that, or maybe I gave you a wrong example. Like, okay, clearly I didn't make it connect the right way. Let me try again. And, just getting frustrated. And I've learned over the years to really read my audience better, I guess is where I would go with that, and kind of go, okay, if this is the reaction I got or the comment I got, my go-to was always like, no, hold on. Let me explain it again, or let me tell you again. And now it's just like, okay, well, I gave you that information. You chose not to take it.
Do with it what you want.
Do with it what you want, and then you will figure out your own path. And I think sometimes that's hard for me to watch because I'm like, I didn't just make this up. I'm telling you this out of years of experience or whatever it may be, and you don't see it yet, but you will. And then I'm like, but that's not for me to, that doesn't need to become my burden and my cross and my hill and my whatever. Like,
exactly.
I want everybody to succeed around me. And, even though I know this is something, like sometimes I could be wrong with that, more often than not, no, this is not just unique to me. I have seen it over and over and over again. Mm-hmm. And if you choose not to take the historical advice, could you be the unicorn that is not touched by this? I guess. Yeah. But I think you're gonna be touched by this, but I think just your personality and your perception is so different. It may not impact you the same way that it has impacted me or somebody else. And so I've got to give you room to be you and to either learn from your own mistakes or to miss out on what I didn't want you to miss out on, but maybe it wasn't important to you like it was to me. So I just think, yeah, I've come a long way with just kind of going, okay, this is what I'm going to say for now, and do with that information what you will. Or sometimes where I'm just like, why, if it was something like, oh, go sign up for this course, or go, you need to sign up for the subscription. Like, Bethany's got this unbelievable digest chock full of information. I'm a client, I podcast with her, and I learn something out of every digest. Go sign up. What do you mean you didn't sign up? Okay, did I tell you how good this is? Like, did I tell you, like, if you go and try to get this information elsewhere, you're going to pay thousands, and, like, you have no idea. And then I'm just like, why am I pushing this on you?
Yeah.
Like, you know what? All I can do is tell you that it's there.
Yeah.
Whatever it is that I'm talking about. And then if you choose not to go forth, that's your journey.
Yeah. Well, and I think, like you said, reading the room, realizing the audience that you have, do they want this information? Doesn't mean that you withhold everything, but you might say it once and you realize that maybe the reception isn't there, or there's disagreement, or they see it completely different. And that's one of those moments where it's like, save yourself. When to shut up? Now, because there's not a reception there, or there's not an eagerness for that information. And that's okay. We can move on from that, and that's not your burden to bear. That's their burden to bear if then something happens because they didn't take that advice. And I think that's a very valuable takeaway. Sometimes it's like, we can't let that go because we know that's going to cause pain, or that's going to cause heartache, or they really need to understand this. But at the end of the day, there's only so far you can go with somebody who's not wanting that information.
And I think that applies to team members. Mm-hmm. There's a lot, like, where we want a lot for our team member, and we're like, well, even sometimes even down to, like, team members and their finances.
Yeah.
And you're like, wait a minute, you're spending what on what? But then you don't have, like, that's not a smart life choice. And, kind of like our kids, I guess, you're going to have to let them make mistakes and kind of fall where they do. But yeah, just sometimes, or even with our patients, and you're like, what are you not getting about this? Let me explain this stainless steel crown again. Yeah. And it's like, leave them alone at some point. Shut up. They've got to decide on their own, because no sooner do I keep going that now I'm going to get the review saying, well, she was shoving her crown down my throat, and then it backfire on me. Like, read the room, see if they are, if the patient is open to really wanting to learn and prevent and, improve their health. And sometimes they are not on the same page, and I cannot take that personally every time. Like,
exactly,
I can want the best for you, but you ultimately have to decide what you want for you.
Yes. And I think you're right. That's applicable to team members. That's definitely applicable to patients. When it ultimately is not, we can't make the decision for them to do XYZ treatment. We can't. We can educate to the best of our ability, but then at the same time, there's a certain point where we have to cut it off.
Well, I would imagine just for you with your clients too.
Yeah.
Like, for you imparting advice to us, and like, if I'm like, thanks, Bethany, I'm not going to heed this piece of advice. I think watching you kind of go, okay, well, there's only so much I can do here.
Mm-hmm. Yeah. So I think that's another key takeaway on when to shut up. It's read your audience, and is there a reception there? Is there an eagerness for the information that you're sharing? And if not, move on. Don't keep beating a dead horse. Shut up. Move on. I use the phrase que sera, sera. What will be out of that exchange. So just let it go and move on from that. And I think that's an important takeaway on this. One other quick example that I'll add in on when to shut up is completely kind of disconnected to all that we've talked about, but I can't tell you how many times I'm in an office listening to team members talk in the hallway or talk to one another, and it is, I wish I could say this, like, hey, now's a good time to shut up, because there are certain times that chatter is just not, either it's not appropriate, there's subject matters being shared that could make somebody else uncomfortable. It's just, we've got tense situations happening in rooms, and that patient's feeling anxious or whatever in the room, and now we're out here chatting and laughing, and I had a meeting that I was in earlier this week where one of the patients in the chair was a highly anxious, irritable patient. And one of the team members popped in to ask the doctor a quick question. There had been a lot of chatter out in the hallway. It was just kind of a loud moment in the office. And the patient got very upset and basically said, "Get out," to the team member. And again, you think, what a crappy patient. Yeah, but also there's a time and a place to be chatty and fun, and then there's a time and a place to shut up. And most of the time during patient care is a time to shut up. And so I think that's just another key reminder. Set the environment appropriately. While dentistry is everyday life for us, it's not everyday life for the patients in our chair. And so we need to have a real focus on patient care. And doesn't mean we can't chat. It just means there's a time and a place to be quiet. So that would be another example.
All right. Well, I think it's time for us now
to
zip
shut
it
up.
Yes.
Should we have a moment of pause here just so people know we're in silence?
We're done.
We're done.
Thanks for joining the conversation today. We hope that you are comforted in knowing that you are not alone, but we also hope that you're walking away with some really great tips and tricks to try in your practice. We value your feedback, so please take a few moments to rate and review the podcast. Finally, we want to make sure that we're covering the topics that matter to you. So track us down on Facebook, Instagram, and Twitter, and let us know what topics you want us to cover. As always, please know that we are rooting for you today as you manage your dental drama.